Too many people think living with a lost tooth is no big deal. Knowing the long-term effects can quickly make people realize it is a big deal. Not replacing a missing tooth increases the risk of losing the adjacent tooth, and the gap left from the lost tooth takes away stability and increases the possibility for this adjacent tooth to loosen and fall out. It gets worse. There's a vast amount of bone loss that can follow tooth loss, which can progress rapidly over time. Bone loss can affect the shape of the jaw, the bite, and the future of your teeth. You may find it difficult to chew food properly, and this can contribute to your health and diet since you will be limited in what you can eat. In turn, you may find yourself fighting obesity and perhaps diabetes because of a poor diet caused by lost teeth. If you wear dentures, you may develop the inability to use full or partial dentures, and you may even find denture wearing painful due to bone structure changes caused by a simple missing tooth. Then there's the matter of facial muscles becoming out of shape or deformed. Your teeth and jaw act as a foundation for your facial muscles and bones. When the foundation starts to crumble, the shape of the remaining teeth, muscles, and bone begin to change. In some cases, it can cause social embarrassment because the face becomes distorted or older looking. Finally, bone loss beneath conventional bridges can cause food to become impacted, increase the incidence of gum disease, and believe it or not, tooth loss can increase the possibility of heart disease and stroke. Missing a tooth is a big deal. Replacing a missing tooth can be done in several ways. Among the methods are tooth-supported bridge, a removable partial denture, or dental implant. Dental implants have quickly gained preference from oral surgeons and patients because of the long-term benefits. The upfront cost of a dental implant may be a little more, but over time, the implant becomes the better value. With normal care, implants can last for years without any worry about failure. Along with the longevity, dental implants can be installed without destroying or sacrificing adjacent teeth. Other methods may require taking out an adjacent tooth for a bridge. Be it one tooth or several teeth, dental implants are definitely the preferred method of replacing missing teeth. What are dental implants? Dental implants are a dental restoration system composed of a titanium screw and a crown. The dental implant process includes a small diameter hole, a pilot hole, which is drilled for the titanium screw. Once in place, this titanium screw holds the dental implant in place. Surgeons often use surgical guides when placing the dental implants. After the pilot hole has been drilled, the implant screw is placed. Once in place, the surrounding gum tissue is secured over the implant, and a protective cover screw is placed on top to allow the site to heal. After the healing is complete, the surgeon will attach an abutment which attaches the crown to the implant. With the abutment in place, the surgeon will create a temporary crown. The process is completed when the temporary crown is replaced with a permanent crown. Dental implants care and longevity. Once an implant has been placed, maintaining diligent oral hygiene habits is required to ensure proper fusing of the implant and bone structure. If cared for properly, an implant restoration can remain in place for more than 40 years. Healing from the surgical procedure to place the dental implants takes up to 6 months, while the fitting and seating of the crowns can take up to 2 months. Again, this time frame depends on individual cases and treatments. Follow-up appointments with your treatment coordinators are essential for monitoring your progress. Implant surgery, follow-up, and aftercare. For 5 to 7 days after surgery, your diet should be restricted to soft foods. If stitches are present, they may need to be removed by your surgeon. However, self-dissolving stitches that do not require removal are typically used. Failure to floss and brush is the leading cause of implant failure. Infection can also occur if the implant and surrounding areas are not cleaned properly. Smoking has been shown to cause high failure rates with dental implants and should be avoided following implant procedures. For more information, contact your oral surgeon.